How would you like to feel more confident detecting murmurs and other abnormalities? My colleagues at Echo Health have created a 21st century stethoscope that's truly amazing. Using the Echo digital stethoscope and app is like nothing I've ever experienced in 30 years as a nurse. Echo is backed by 4 million heart sounds and FDA-approved AI that analyzes while you listen. Echo provides amplification, noise cancellation, and Bluetooth compatibility, and you can actually see heart rhythm data right on the device. With the Echo app, abnormalities are flagged in seconds, everything you hear is instantly recorded, and the exam flow feature walks you through every step of your assessment. You can even create a PDF summary of your findings to share with your colleagues. Right now, you can get $50 off plus a free customizable chest piece cover at echohealth.com/Keith, and your purchase is even HSA and FSA eligible. Plus, Echo guarantees you'll detect heart and lung conditions more confidently, and if you don't, just return it for a full refund. Go to echohealth.com/Keith for $50 off plus a free chest piece cover. That's ekohealth.com/Keith. Why do so many nurses want to transition out of acute care nursing, or maybe not even work in the hospital at all? Let's talk all about it right here in episode 516 of The Nurse Keith Show. Hey there, this is Nurse Keith. As always, this podcast is about you, your personal and professional development, your nursing career, and the healthcare system writ large. And I'm here to share education, ideas, and frequently informative interviews with some of the most inspiring people from the worlds of healthcare, nursing, and entrepreneurship. Although today, on episode 516, you are here just with little old me. I love having you along for the ride, and thank you so much from the bottom of my nurse podcaster's heart for being part of the Nurse Keith Nation. If you'd like to help other people find the show, you know I'm always asking you to consider leaving a rating and review on Apple Podcasts. That is so super helpful. You can also become a patron at patreon.com/Nurse Keith. As little as $2 a month shows me some love, lets me know you're listening, that you value the show, and helps keep the lights on and things rolling here at the Nurse Keith Show. That's at patreon.com/Nurse Keith. I appreciate my patrons so very much. You can also share the show with anyone who you think might enjoy it or get something out of it. And no matter how you're interacting with the Nurse Keith Show, including listening right now like you are doing if you're hearing my voice, thanks for being here. Please head over to nursekeith.com to find the show notes for this episode as always, or you can find the show notes in the app where you happen to be listening on your smartphone or other device, whatever that happens to be. As I said, we're here today just with me, no guest. It's one of my rare solo episodes. You know, this show used to be all solo all the time when I first launched it, but I began doing interviews so many episodes ago, over 400, I think. And I just love interviewing people. But today it's just me because I have a topic I want to talk about. And then next week, we'll be back to our regularly scheduled interviews with amazing guests as always. So as I stated at the top, I have a lot of opinions and have a lot that I am noticing about nurses' relationship with acute care and the hospital in general, that hospital environment. Now, we know from the data that here in the United States, I don't know about other countries, but here in the US, about 55% of nurses work in acute care hospitals, more or less. So it's a little more than half of nurses. And when nurses talk about hospital nursing being, quote unquote, the real nursing, and I'm doing huge air quotes here right now, you know, that gets my hackles up because real nursing is the nursing that you want to do that has some benefit to the world, whatever that benefit happens to be, whether that benefit is research, writing, academia, entrepreneurship, hospital nursing, home health, hospice, school nursing, camp nursing, cruise ship nursing, NASCAR nursing, whatever it happens to be. I mean, if it's what you do and what you like to do and what you think holds value, then that is quote unquote real nursing to me. So for those of you out there who hear that message that, oh, you don't work in the hospital, that's not real nursing. I just call BS on that. And if you're one of the people out there who holds that opinion that those of us who don't work in acute care aren't real nurses, I beg to differ. And I would love to disabuse you of that opinion. But anyway, just to give this a little, that's personal context, some of you have probably heard this story before, but many of you have probably not. When I graduated from nursing school in 1996, I got my associate's degree, got my bachelor's a few years later at University of Massachusetts Amherst. And when I first graduated with my associates, I landed a job right after graduation at a community health center. It was a federally qualified health center, FQHC, which is a health center. Those are usually federally funded. They get some sort of federal, grants or whatever. They don't necessarily have to be a nonprofit, and they generally serve underserved, often urban communities, but not always. But I was working in a city, Holyoke, Massachusetts at the time. And when I first announced to my peers and also to my professors, because we were just finishing up nursing school, that I was going to be working at this community health center and I wasn't going to work in the hospital, there were gasps, you're not going to get 1 or 2 years of acute care med-surg nursing. That's career suicide. I heard that so many times. That's career suicide, Keith. How could you possibly be doing that? And I said, this is just what I feel guided to do. It's what I want to do. And even though in school I did very well in acute care clinicals, and I actually felt fine in acute care, and I even won the commencement award for clinical excellence from my professors, it just wasn't the thing that I wanted to do. I didn't want to work in the hospital. I knew that held certain problems and liabilities, but I was willing to take the heat and take the consequences of my actions and accept them and move on from there. So obviously, I've been a nurse for 29 years as of this very month of May 2025, 29 years, and I've never been unemployed in my entire career except during periods when I actually wanted to be self-employed. That's a whole nother story. And since it ended up not being career suicide, I feel like I have an object lesson for other nurses that, yes, you can skip acute care. Yes, it holds some liabilities if you do so. However, you can actually have a pretty viable career, never setting foot in a hospital as a nurse, ever, 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 if you choose to do that. And like I said, you have to accept the consequences of your actions. And if you do that, there definitely are consequences. But what I wanted to say is that I'm a career coach, right? I hear from so many nurses. I can't even tell you how many nurses contact me saying, I hate hospital nursing. I don't want to work in the hospital anymore. I've been a nurse for 1 year, 2 years, 5 years, 10 years, 20 years. I'm tired of the hospital. I can't take it anymore. Administration, staffing issues, mandatory overtime, et cetera, nurse-patient ratios, you name it, people talk about it. They also talk about the stress of having to care for 4, 5, 6, 7, 8 patients at a time drives them absolutely batty. They don't even have time to pee. You know the drill. Everybody knows the drill. So whether you work in the hospital or not, hospital nurses run themselves ragged. Now, do we want them to run themselves ragged? No. Should they be running themselves ragged? No. But are they? Yes. And it is often a terrible experience. So I hear from a lot of nurses who have been in 12, 16, 18, 24 months, and they are torn up. They feel like they have been fed to the lions, that they've been, whatever metaphor you want, they went directly into the fire. They skipped the frying pan, more or less, out of school going in, unless they were one of the lucky few who were in a new nurse residency, and they got walked through it with a lot more support. Now, if you've been listening to the show a while, you know my feelings about new nurse residencies, and that every single new nurse in the entire country, the entire world, should get a 1 to 2 year new nurse residency. I think that should just be the bottom line. However, since we're not in a perfect world and no one listens to me anyway, well, you're listening to me, but no one else does. So no one wants my opinion. That's not going to happen. So if all these nurses are being thrown to the lions, jumping straight into the frying pan, what can we do? Well, I hear from them and they want out. Like I said, maybe they've been in a year, maybe it's 10 or 20 years, 30 years, they want out from acute care. However, when we think about leaving acute care or not leaving an acute care at all, we think about what are the alternatives and what are the consequences? Well, we know working in acute care leads to burnout, traumatization, depersonalization, a physical and psychological and emotional and psychospiritual toll that it takes, the lack of autonomy that nurses experience, the lack of work-life balance, etc. But what I hear from so many people is, I don't want to lose my skills. I've heard that so many times. Or I need to get those skills because what am I going to do without them? Well, I can say from personal experience that yes, there are skills you won't have if you don't work in the hospital, but you have to think about what it is you want in your career. What are you trying to build for yourself? Are the skills you learn in the hospital the skills that you want? Are they the skills you need for the career you're working towards? If you truly want to be a adult geriatric nurse practitioner or a psych mental health nurse practitioner, maybe the skills you learn in med-surg aren't terribly important for you if you're pretty clear about what it is you want. However, if you're very clear that you want to work in the OR, you want to work in the ICU, et cetera, of course you need to stay in the hospital. You might leave for a year or two and maybe work in hospice or do something else, but then you might need to go back, of course, if you want to work in the OR, the ICU or something. Of course you got to go back to the hospital. But for those of us who aren't into it, even from the get-go, from the time that the flag is waved and the race starts, if we're not into it, we don't have to do it if we don't want to. Now, what do we lose if we don't work in acute care? Like I said, the skills. And there's also that sense of, yes, I'm a quote unquote real nurse because I work in a hospital. That is it's an identity issue that so many nurses need to wrestle with and come to grips with. And you need to be able to own that sense of, yes, I'm a nurse. No, I don't work in the hospital. And, if I'm at a party, I don't go to many parties, or I meet someone and they say, oh, so what do you do for a living? And I say, oh, I'm a nurse. And they say, oh, what hospital do you work in? And I often roll my eyes and say, I don't work in a hospital. And the other person, if they're fairly ignorant, might say, oh, I didn't know nurses do anything but work in hospitals. And I say, well, do you have a couple minutes? I'll tell you what they do. So let's talk about that. What do nurses do? Other than 55% of work in acute care, what are that other 45% doing out there in the world? Well, in patient-facing roles in the non-acute care space, they could be school nurses. Maybe in the summer they work at camps, summer camps. They might be public health nurses, and public health nurses, I'll tell you, work hard. And during things like that pandemic we had a couple years ago, remember that? Public health nurses were hugely important during that. Now they are the unsung heroes. Nobody thinks about them anymore. But during COVID, public health nurses were the thing. Everybody looked to them for a lot of guidance in many communities. Now, like I mentioned, when I first got out of school, I worked in a federally qualified health center, an FQHC community clinic out there in the world. That was wonderful, an amazing experience. I worked mostly in the Puerto Rican community with underserved people from that area of Holyoke, Massachusetts, Springfield, Massachusetts. It was awesome. I learned so much. I worked with amazing clinicians, amazing doctors, PAs and NPs. And my learning was deep and broad, and I became a generalist extraordinaire in many ways. So I can tell you that can be truly a wonderful experience if you're into that sort of thing. A lot of nurses work in other types of clinics, like, there's a lot of academic medical centers that have clinics attached to them. They might have a renal clinic, cardiology, a cancer center, et cetera, et cetera. Nurses work in all sorts of clinics or physician-run practices. Someone might be coming in just to manage their diabetes, and a lot of nurses go into diabetes education, become certified diabetes educators. A lot of nurses now are kind of like nurse navigators, where they work for insurance companies and have a caseload of patients they talk to on the phone or on video or chat with regularly, and they follow them and teach them and keep them on task, help them manage their medications, help them manage their appointments, prior authorizations, et cetera. So insurance nursing is huge. Lots of nurses are working for insurance companies. Some even visit patients in their homes for, let's say, Blue Cross Blue Shield. So that can be a whole nother world. Insurance nursing is enormous right now. There's lots out there. Now, since the pandemic, telehealth has become a thing. It is truly a thing, as most of you know. Maybe some of you receive telehealth yourself for your own medical care, and lots of nurses work in telehealth, whether it's triage or, like I said, patient navigation, case management, nurse advice lines. There are plenty of telehealth jobs out there. Now, there's more indirect patient care roles where you're not necessarily interacting with patients, but you are still doing very important work. Informatics is enormous these days. There are plenty of places for nurses to find a way to work in informatics, whether you have an informatics master's degree or doctorate or not. There's plenty of space for nurses who are experts or want to become experts in various areas of coding and other aspects of informatics. Utilization review, quality assurance, quality control, et cetera. Now, with the advent of AI, where AI is really becoming a major factor in nursing, I surmise that nurses who are conversant with AI are going to have a new space or new spaces opening for them in the next 10 to 20 years. We can't even predict what that might look like, but I am pretty sure there are some master's degrees emerging that address the AI issue for nurses who want to focus on that particular area of growth. And I'm sure there are many nurses who are now looking at focusing perhaps PhD research and dissertations on the intersection of AI and healthcare and nursing. So if that is an interest of yours, keep your eye on the prize, because there is no doubt in my mind, hands down, that this is not going to be an enormous area of career growth for nurses in the next 10 to 20 years. Mark my words. I think it's a pretty easy prediction to make. So it's not like I'm going out on a limb here. But if that is an interest of yours, start looking into it now, get in on the ground up, start learning, maybe learn to code, etc. There will be a place for you if that's what interests you. Now, I did mention remote roles like telehealth, insurance nursing. There are also some other areas like clinical documentation improvement, CDI. We also have legal nurse consulting. There are many nurses who go out on the entrepreneurial path, and we will get to entrepreneurship in a second, but I want to mention legal nurse consulting is one area that is worthy of some people's attention. Legal nurse consulting is definitely an area where nursing expertise can play a great role. Now, where do legal nurse consultants work? They often have their own practices, or sometimes they are hired by a law firm and work directly with a law firm as either a consultant, like a 1099 employee, or as a W-2 employee. Legal nurse consultants, of course, based on the name, you can tell they are well-versed in jurisprudence. They understand how to read charts. They understand how to serve as expert witnesses, and they understand how to advise a lawyer on, let's say, what a prudent nurse or healthcare provider would do in a particular situation, because that lawyer is looking at either defending someone against a malpractice suit, or maybe they're on the offense and they're prosecuting someone for a malpractice issue, and the legal nurse consultant is responsible for gathering data, maybe gathering witness testimony, maybe interviewing witnesses, but definitely doing a lot of deep chart review to give the lawyer a sense of what was done, what wasn't done, what was documented, what wasn't documented, what was prudent action by the person or imprudent action by the nurse or other healthcare provider. Was something done wrong? Could something have been done better? So a legal nurse consultant, that is a really fascinating area that some people are seeking certification and training in, because honestly, there's a lot of money to be made in that particular realm. Now, before I move on to some other entrepreneurial and creative avenues, I also want to mention that many nurses go into the pharmaceutical world, either in research, being a nurse who, let's say, interviews and does assessments on patients being brought in for pharmaceutical research studies, phase 1, phase 2, et cetera, or they might be in pharmaceutical research in other roles, consulting roles. And then there's also the medical device space. Some nurses do become pharmaceutical reps in terms of selling, going out and selling, the use of some new drug to doctors, et cetera. You've probably run into those reps over the years. But there's also medical device space, which is very interesting, where you might not necessarily be the salesperson for that medical device, but you may be a nurse expert who goes out and trains other nurses and healthcare providers to make use of that device. Let's say, for instance, there's a new handheld device that's used for collecting information at the bedside. And this device is being sold to various hospital systems. Well, somebody's got to go out to those hospital systems and train the nurses how to use the device at the bedside. And that's where the medical device representative or trainer comes in. And let's say these devices are being used in the ICU, in intensive care. Well, if you're an ICU nurse or have experience in that sort of space, well, you're the kind of nurse that medical device company is going to fall over themselves trying to hire, because they need somebody to go out and train those nurses how to use the device they're selling. Because if they can't train them how to use it, no one's going to buy it, and no one's going to want to keep it once they buy it if they don't know how to use it. So you could be the one going out there to train nurses how to make use of this device. So that's a very interesting space. Now, in terms of entrepreneurship, you all know, if you've listened to the show, that I'm a nurse entrepreneur. I have been over the last 15 years or so, since around 2010. I do still work as a nurse periodically. I have been working regular nursing jobs for the last few years, and I'm planning to do so for the foreseeable future at this time for financial reasons. But I have been in and out of the entrepreneurial space for 15 years and have learned quite a bit. Now, we all know coaching is big in the world. Lots of nurses have gone into coaching, whether it's health coaching, where you actually are working as an independent contractor. People are hiring you directly to coach them on their health. That is definitely a growth area for nurses. And I can say, as an aside, a lot of insurance companies are now hiring nurse coaches to coach and manage their patients. So just saying that coaching doesn't necessarily have to only be entrepreneurial. You can be hired by an insurance company or other organization to be a coach as a nurse. Just saying. So yes, lots of nurses are out there with their own practices as coaches, whether they're doing life coaching, health coaching, career coaching like I'm doing, life transition coaching, etc. There are nurse business coaches as well, nurse relationship coaches. I've met a couple of nurse coaches who are more or less spiritual coaches and guides. So coaching is wide open. There's no certification necessary. There's no licensing. You can say you're a coach tomorrow if you want to and build a website and just become a coach. But I recommend you do get some training. That's definitely recommended. But anyone can hang a shingle as a coach tomorrow. I mean, my dog could build a website and say he's a coach tomorrow, but I don't know what he would coach anyone on other than chewing on treats and barking at coyotes. But, that's his problem. But anyway, you all know probably that I'm a writer, a nurse writer, and there are many, 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 many nurse writers out there, more than I could throw a pencil at. And, I think that space has actually become a little overcrowded. So many people have wanted to become nurse writers that I think that area has become a little oversaturated, admittedly. And with the advent of AI, I think writers like myself might go by the wayside to some extent, unfortunately. But there is writing work out there for those of us with talent who can find the clients to work with, though I do think that might become more difficult as time goes by. So for those of you looking to get out of acute care, these are some ideas for things that you can do other than working in the hospital. Now, I also podcast, of course, you're listening to my podcast. That is not an area where you can necessarily make a ton of money. I've made a little money and make a little money podcasting, but for those of us small podcasters, money is generally not the issue for us doing podcasting. Sponsorships can be lovely. I've been hired by organizations to host a couple podcasts here and there for limited series of episodes. But overall, if you want to make money, podcasting isn't necessarily the way to go. Some nurses have made money and are making money as influencers on YouTube and TikTok. I think there's probably more money there than in podcasting for nurses right now. So if you would like to become a video personality, I think there's definitely money for you there. And consulting, there is consulting work out there. You have to sort of create it for yourself and become a consultant in some area where you have expertise. There are plenty of nurse consultants. That is a whole kettle of fish that would take an entire episode to dive into. But there are nurse consultants consulting on many, many, many things out there, whether they're launching courses or creating businesses that provide a service to either hospital systems or others. My friend, Dr. Renee Thompson, for instance, started as a nurse consultant, consulting with health systems who want to eradicate bullying from their hospitals and medical facilities. Now she has her own faculty and an institute, the Healthy Workforce Institute. She took a consulting practice and built it into a 7-figure business, which is pretty amazing. Renee is an amazing person out there. Look up the Healthy Workforce Institute if you want to experience and see what it's like to be a nurse consultant who becomes wildly successful. Speaking at conferences is also a thing. I've spoken at many conferences over the years. You can make some money as a speaker. Some of us are more proficient and make a lot more money than others. I speak periodically. Some years I might speak 4 or 5 times. Some years, like 2025, I've not spoken at all. 2024, I think I had 1 speaking gig. So that can be a very erratic area to make money. But if you want to have a little side hustle, speaking at conferences can be a way to generate some income. So in terms of not working in the hospital, I just wanted to paint a little picture of what is possible. I have not covered everything. I haven't talked a whole lot about research. I haven't talked a lot about other areas where nurses have found success. Whether this is a direction you want to head or not, I think it's helpful to know, and I think it is comforting to know that the hospital isn't the be-all and end-all of the nursing profession. Like I said at the top of the hour, or the half hour, as it were, 55% or so of nurses work in hospitals. The other 45% of us, some of us do some pretty fascinating and interesting things and actually can make a pretty good living at it as well. So if you are working in the hospital, you are feeling stuck. You are feeling like, I need a change. I don't know what I need to do. I don't know how to learn what the possibilities are. I recognize the mountain of difficulty that can present to you. But if you're a nurse, you know how to gather information. You know how to do research. So research different roles and job descriptions. Take an online course. Look into various certifications, informatics, legal nurse consulting, coaching, etc. Explore what the possibilities are. See if there's actually a degree program you would like to go into that would either at the master's level, etc., would give you a set of skills or a set of some knowledge that would help you to launch into an area that will take you away from acute care nursing. Network. Go on LinkedIn, talk to people doing interesting things, reach out to people like myself or Dr. Thompson, plenty of other people. Check out LinkedIn groups, Facebook groups. Look at people doing cool things. Send them a heartfelt letter or email. Tell them you're fascinated by what they do. Tell them you would love to have a chat with them just to learn a little bit more, that you value their time. If they could give you 15 minutes just for you to ask some questions, you would be so grateful. Many people like to talk about what they do. I'm happy to talk to people about what I do. So many people reach out to me, and I'm more than happy to hop on a call for 10 minutes and give someone the lowdown on whatever it is they want to ask me. If you're going to try to work not in the bedside, revamp your resume. Get some help from me, for instance, some coaching. Get your resume in shape. Look at the skills that are transferable from acute care to the non-acute care space. Look at, if you're interested in home health, what are the skills they're looking for in home health or hospice? What is it that you need to be able to demonstrate so that you can show that you're a viable candidate for that role? Let go of the guilt about, quote unquote, abandoning the bedside. Know that your license and your knowledge and what you bring to the table, your experience, are valuable in any setting, wherever you want to work. Remember, your pay may change. You may make less. You may make more. There's going to be a learning curve. You might feel like a new grad again if you enter a new space. But, nurses are learners. We are studiers. We are assessors. We're data gatherers. We understand how to learn. We understand how to apply ourselves. So if acute care is not for you, if you want to get out, there is an out. There are many, many ladders, lifeboats, etc. There are ways to get out of acute care. You are not stuck in any way. If you're a new grad and you don't even want to touch the hospital at all, it is possible, give me a call. I'll spend 30 minutes with you and give you a pep talk. You don't have to go into acute care, bearing in mind there are some liabilities. There are things you give up by not doing it, but there are also things you gain. You have to just go into whatever it is you're going to do with your eyes wide open, knowing what the consequences might be of any action that you take. So you're not stuck. Your nursing career can evolve with you. It can evolve with the environment around us as it changes. So share this episode with others who might be burned out or wanting to get out of acute care. Get in touch with me if you have questions, if you have success stories, if you have concerns. I'm happy to chat with you. And we have more episodes coming up with some great guests. There's plenty to talk about in nursing. There's no end of what we can discuss. And I hope this has been helpful. I hope it's been a shot in the arm for some of you who just feel like acute care is you just need to get out or not even enter in the first place. I hope that this gives you a little inspiration, a little insight, and a little something to chew on. So thanks for listening to this episode of the Nurse Keith Show. The show notes will be at nursekeith.com or in the app where you're listening. If you need holistic career coaching to elevate your career, get in touch with me at Nurse Keith Coaching and nursekeith.com. Mention the show, get 10% off your first coaching package. We are proud members of the Health Podcast Network, which you can find at healthpodcastnetwork.com. And we are produced by the inimitable and wonderful Rob Johnston of 520R Podcasting. And remember, Maya Angelou said, "You may encounter many defeats, but you must not be defeated. Remember that your difficulties do not define you. They simply strengthen your ability to overcome." Be well, dig deep, seek joy, keep in touch. This is Nurse Keith saying adios, of course, from beautiful Santa Fe, New Mexico. And we will catch you, as always, on the proverbial flip side.